Hi, everybody. This is Nicole Foss, your current president of the American Cannabis Nurses Association. Today, I'm going to be interviewing Michelle Zang, who is a member of the American Cannabis Nurses Association. Her story has come up a few times as my journey of president. She continues to be in committee meetings. She continues to be involved, and she had shared with me that she had this success, and I said, Michelle, you need to come share the success with our members and tell the story and tell your journey. And I'm recording this at the end of our interview, and I'm so excited to share it with you guys because what Michelle has done is she has embodied the ACNA mission. She is advocating, she's collaborating, she's educating, she's researching, she's building policies and helping regulators, and she's doing it all. And I hope that you enjoy her story. I hope it brings you the passion, the love, and the light that cannabis nursing is, and that you'll join me in congratulating her on her awesome success. Enjoy the interview. Like, tell me A to B, how you got to where you are today.
Okay, so nursing school wise, when I was 5 years old, no, I'm just kidding.
Wow. Okay. You've been in nursing for a while.
I graduated from UNLV School of Nursing, back in 1990s, and didn't really go into nursing right away because I was kind of like just kind of taking my time. It wasn't really my first chosen field. It was chosen for me per my culture and my mother, and which right now I'm so grateful for her to do that because I am experiencing the positive effects of being a nurse, and all the goodness about that comes with being a nursing field, right?
Right.
So after a rocky start, I became uh, a first I started with cardiac. I was
Okay.
IMC, yeah, IMC floor in the hospital, and then met my husband at that point, came out, and then we started a practice in podiatry. Um,
Okay.
that was for 13 years. And then after my divorce, which came out to be a positive thing,
Mhm.
um, I got into case management nursing and has been in case management nursing since.
Okay.
And then, lo and behold, present moment, I am here in my next wonderful phase of nursing, and it's cannabis nursing. I'm so excited.
And it's
Never
like,
knew. Never
yeah, it's the next level of nursing,
the
right?
next level. Like, who knew, right? Like, people would look at me like, "You're a cannabis nurse?" And I'm like, yes. You
Yeah.
have no idea how great it is. And then once they start talking to me, they're like, wait, 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 wait. Can I have your number? Can I have it? And it just snowballs after that, And at first they're just like, I'm not sure about that.
Yeah, because they don't know it exists, right? And
Right.
but they're curious. They're always curious. They always want to know, okay, well, what about cannabis? Like
Right. Yeah.
CBD, THC, like
Right, exactly. You look at the twinkle in their eye, right? Like,
yes.
oh, you're the fun nurse. I'm like, oh, wait till I talk to you. And then you'll see exactly what I have to offer.
Exactly. And that's what's so great about nursing, right? You can go from cardiac to podiatry
Mhm,
to where you're at today. It's
mhm.
flexible. You get to follow your passion. There's nothing better than that.
Exactly. I mean, I tell the new nurses nowadays, right? Like, hey, you have got to do your, front line. That is the most important part in nursing. That actually will develop you in regards to patient care, right? Because everybody has got to get the gritty nitty, you got to be there.
Yeah.
And
Yeah.
then once you get that under your belt, hey, the world is your oyster. The world's
Okay.
your oyster. Because nursing care really is, patient care. That's it. We won't exist without our patients. So
Yes.
that's your
Yes.
place. That's your foundation is nursing care. And then you can expand
Right. Right.
anywhere in the world. And it just amazes me. I,
Yeah.
I'm so grateful that my mother actually had the foresight for me.
That, it's a blessing, right?
It's a blessing. I stomped and I gave her attitude, but
I
now
don't want to
it's
be a nurse,
wonderful. Yeah.
but here you are. Here
Yeah.
you are. So tell me about where you're at now. Tell me about your subject matter expert program. Like, tell me how you've developed it, what gave you the courage, the passion, and what it's developed into. Because that's really what we're here for. How did you
Okay.
get to that success?
Okay, you ready for the ride?
I'm
Okay,
ready.
Nicole. All right. I know you can relate. Okay. So let's start during the pandemic, right?
Okay.
So, you know, being in I come from the healthcare field, health insurance field, as
Okay.
you're probably
Yeah.
a little bit more comfortable about. Okay, so I was the post-acute nurse case manager for the COVID patients. And as soon as they get off, I get them for 30 days. Okay, that's my role, my current role. And unfortunately, during those times, it was such a trying time that not only was the patient trying to understand what's going on, then, the environment, the world was trying to understand what it is. Us nurses and us medical team was along for the ride, and it was
Yeah.
never in any of our textbooks, right? It didn't exist. And so, of
Nothing's
course,
preparing you.
nothing,
Nothing.
nobody
Yeah.
prepared
Yeah.
us for that.
Of
It
course.
was so the emotional gravity, right? The emotional, heart wrenching, gut wrenching enormity of that role. And I had people from all over. And it was almost like during that time, remember how emotionally, physically, mentally, psychologically, spiritually draining it was, right? And one day I literally got to a point where I felt like I'm burning out, or I'm probably already burnt out.
Yeah.
And I was like, I couldn't take any more. I couldn't take any more pain. I couldn't take any more emotional distress and the trauma that we've had. I can't even imagine the front lines because I'm second. They were first. They were ahead of me, And at that time, I was crying for people that I didn't even know about, or I just knew from a friend of a friend, right? And the
Yeah.
second they're like, oh, you're a COVID nurse, or let me talk to you. What's going on? This is what I'm experiencing in my family. At that point, and I come home and I'm just like, I don't know what to do. I'm like, okay, you know, get out of that arena because you need to be here again to support your family, right? It just never ended, just never ended. And so one day I got to a point where it was the lowest my point. And I sat there on the couch, I remember, and I said, I'm very spiritual. And I just lifted it up and I just said it in prayer. And I said, okay, I don't know what to do at this point. I'm ready to go. I'm ready to leave. I don't think I am cut out for this at this point. I need to do something different. And I said, enlighten me, guide me, show me what I should be doing next.
Right.
I kid you not, Nicole, the TV was on, and it was just on just for loud, for noise. The TV said medical cannabis. I mean, it's been, we've had medical cannabis for a
Of
while,
course.
right? I mean,
Yeah.
come on, you go down California. I mean, that's. And then, but that moment, it was different, right? I'm like, wait, what's the difference with this one? And
Mm.
then I'm like, you know what? Let's dive into that. Let's
Yeah.
check. Started researching. Lo and behold, ACNA showed up. Top, right? Top. And as I'm going to ACNA, they were talking about, oh, I just missed the conference or something like that.
Mm. Okay.
And I'm like, are you serious? And I said, there is such a thing as cannabis nursing. And I immediately called, and the lovely lady on the other line from New Jersey, she probably she was going, what is wrong with this girl? Because I was just like, oh, tell me more, get me more education. How can I get into this? How can I be proactive? How can I be participating?
Right.
And she said, look into Pacific College. And I'm
Mm.
like, all right, let's go into Pacific College. I went to Pacific College, enrolled myself, okay, and was lucky enough to have gotten Carrie Cadu, Rachel Parmley, and Barbara Ochester, okay,
Yeah.
as my professors. I mean, how lucky can I get? And
That is a pretty good
right,
dream team when it comes to cannabis
at that
education.
point, I initially went for a master's program, but at that point, because the program was still kind of iffy and all that
Yeah.
stuff, so I just went in and they told me, hey, just get your certification at this point.
Mhm.
Fine. Any information is more than what I have, right? I went into my employer, and they look at me and they're like, well, as long as it's accredited, and I'm like, all right, looked into it. It was accredited. Started my school, and started my program. Loved every moment of it.
Yeah.
Absolutely. I mean, I could not get enough of it. I'm like, wait, Michelle, we're talking cannabis here.
Yeah.
And I'm just like, and then my mom was already in dementia at that point. And she was actually my biggest inspiration on top of my career change, right? And once I heard about, hey, there could be, and she's into tea, in my
Mhm.
culture, tea is very big,
Yes,
right? And
yes.
so, and I'm like, oh, hey, if I can help her actually have a peaceful quality of life, right? And no pain, comfortable, safe, right? So I I literally dug my heels into it. And then during the kind of like the towards the end of the program, so we had that, hey, how can you, uh, what are your thoughts about how can you enlarge your
Yeah.
education, right?
What are you gonna do with it?
Yes.
Yeah.
So what now? What was the
Yeah.
next question, right? And as I was actually formulating the last few months of my schooling, I sat there and I'm like, Michelle, what can you do? And I swear to you, I sat there and I'm like, wait, I'm a nurse case manager. I may not have the same level, I'm a novice compared to the Carries, the Rachel, the Nicole, the Barbara. I may not have that level of expertise, but I've been a nurse case manager for at least a decade. But I've been a nurse for almost 20, or for approximately 20 years or so, right? I said, how can I marry those two? How can I know that part, right? How can
Yeah.
I bring that together? And then all of a sudden I sat there and I'm like, wait, Nevada, and in one of our curriculums, right? You have to kind of incorporate data from where you are.
Mhm.
Nevada is top 10.
Yeah.
We are one of the most lax states in our rules and policies in regards to cannabis use, right? So I'm like, wait. So at that point, I started kind of going and I'm like, hybrid. It just kind of kept coming to me, hybrid treatment plan. But
Mhm.
then I have to admit, I sat there and I'm like, oh, are they going to take cannabis? I'm like, this is an international, well established, business model that I'm going to be, and and it's
Yeah.
huge. They're all over the world.
Right.
And I'm like, how am I going to approach this in a way that they're going to listen, right? That they're going to say, that's a possibility. I didn't want them to say yes right away because I know it'll take a while. Okay. But
Right.
I'd like for them to at least go, hmm, hey, I don't know. So one day we were having a meeting and my medical director, no, my chief medical officer happened to be there. And I took it upon myself that day and I bypassed everybody. That chain of command that
She
we're
went
always been
straight to the
told. Yeah,
top.
I went straight to the top. She is the most amazing. I have one of the best CMOs because she's young, she's open, she's very approachable, and at the same time, she's very intelligent. Okay.
Mhm.
And she's strong and a powerful woman in herself. So I went up to her and I said, hey, Doc, I said, we're just talking about, our meeting today and how we can continue to increase patient care. I said, I kind of have an idea about increasing patient care. And she said, what is it? And I said, well, so you sent me to school for this. And I do have a certification behind me, okay, from an accredited college that this organization paid for. I said, what about cannabis nursing? She looked at me, she's like, cannabis nursing. I said, well, cannabis care nursing. And that's when she said, she didn't say no. She actually said, Michelle, I want to hear about it. And she
Wow.
turned around and she said to the VP, she said to the VP, I want to schedule an appointment with Michelle so I can hear what she has to say. And at that point, I was like, and the VP looked at me and she says, about what? And I, and I said, cannabis care nursing. She looked at me, she's like, interesting. And that's when it kind of started the ball rolling. And I was so grateful that I had two women who are able to hear me out, who didn't close the door, who didn't say, nope, we can't touch that, we're not going to touch that, we're not even going to look at that, right?
Yeah.
They heard care and nursing. And
Mm.
that's where it mattered because we happen to belong in one of the most trusted, right?
Right.
Trusted professionals.
Year after year.
Exactly. And they knew that I wasn't going to stray them anyway, you
Right.
know? And they knew that, okay, how is this going to be affecting us as an organization? And that's when I sat there and I'm like, all right, Michelle, critical thinking skills, critical thinking skills. I said, you passed the first hurdle, right?
Yeah, that's the biggest
That's
hurdle.
the
That's
biggest
like,
hurdle. But then little did I know the subsequent hurdles that came afterwards. I was just like, oh my goodness, Michelle, what
yeah.
did you put yourself into? So then I started working. I started really kind of like brainstorming, right? Like,
Mhm.
what is the best way to reach out? And one of the things that we were taught from Pacific College is the TED, the seven ways of TED Talk, I believe that was in the
Mm.
book. I used that actually. And I said,
Nice.
yeah, I was like, I said, Michelle, how can you present it wherein it will be controversial, but it will be eye-opening, but it will be exciting, and they want to hear more about it,
Yeah.
right? So I looked at a few TED Talks. The most important one was the one by Bill Gates when he opened the mosquito, right? And I'm
Mm, yes, yes, watched it. Yeah.
I said, how can I make that kind of like that impact in a room full of, doctors, nurses, analysts, and all that stuff, right? So I immediately created um, what I call my cannabis. First, I decided on what my term should be. And it
Hmm.
should be a fun term, but at the same time, a catchy term,
Yes.
because we're
Yeah.
talking cannabis.
Yeah. And your marketing and you kind of got to make it like
Exactly.
intriguing a little bit because it's already mysterious,
It
right? So it's
is.
like you've got this mysterious kind of like, dare I say, like sexy appeal to it. And you're like, hey, cannabis, like let's talk about it in the back room over here.
Exactly.
And so, yeah, it has to be fun. It has to
It
be
has to be
intriguing.
fun,
Yeah.
intriguing, and exciting. So I figured cannabis care, because that's what it is, that's what I am, right? But subject matter expert, because we need to have that legitimacy, right?
Mhm. Yeah.
Because then it's like the first part is like, the second part is like, oh, then she kind of has an idea about what she's going to
Yeah.
talk about. So when I created this PowerPoint presentation, I started with the basics. Okay. I started with the basics. I started data and I said, okay, what is the most important part that a business wants to hear? Data,
Yeah.
data,
Data for patient improvement.
data for
That
correct.
yes.
Correct. And I said, what is the next thing that we need to know? Because I'm in a room full of medical people. They
Mhm.
want scientific information,
Yes.
research, something that is behind it. So then I added that in. And then as I went along, I kind of tweaked it depending on who my audience was, right?
Mhm. Yeah.
Because patients, they don't want to know about data. They don't want to know about the science. They just they do, depending on who. But what they want to know is, hey, can this remove my symptoms?
Yeah.
Can
Is
this
this gonna
help me
help
take
me?
care? Exactly. And how can I make this medicine really work for me,
Yeah.
right? Because most of the time it's recreational. They come in and they're like, oh, I take it because, I have PTSD and all that stuff. And
Right.
whenever I tell them, I'm like, do you know that is a medical diagnosis?
Yeah.
They look at me,
Like,
they're like,
there's no
what?
difference. Recreational is such a garbage term.
Exactly.
It means nothing. Like it's all medicinal. It's just adults are using it instead of kids, and we can go to the store and purchase it in some states, right? Like,
Exactly.
stop
Exactly.
using the recreational term. It's
Exactly. But that's what they know here in Las Vegas.
right.
That's what
Yes.
they know, right?
California too.
And I sat there and I'm like, it makes you sleep. I said, there's such a thing called insomnia. You
Yeah.
know what I'm saying? And when there's an insomnia thing, that actually falls under a heading of a diagnosis. Could be a chronic one too. You know what I'm saying? So the second that opens up and they're like, what? I'm actually taking it for medicine? I'm like, yes. And when you take an ibuprofen, do you just take it because you just want to take it? Or do you read the label on the back of it? And they always say, I do. So why are you not reading the label of cannabis? And that's when the whole world just go poof. And I'm like, yeah, you don't just keep popping that pill in, right?
Yeah.
You know that you can take how many milligrams up to a degree, but then you stop when you know, oh, 200 milligrams is enough for me, right?
Right. Right.
Exactly. But the more you take it, the more your body's going to say, hey, it's too much. It's too much. And in our field, right? the way we capture patients is complications, is symptom management, symptom control. And that's how they show up to us first. And so that's how I was able to actually formulate the program. Because in my line of work, I am not, at this point, the proactive comes after the
Right.
reaction, right? And so I need to be able to tweak that so then I can provide the education so they can actually still be within the confines of the business model, right?
Right.
But at the
Right.
same time, still be in the confines of nursing care. Because the main point of the CC program, which is why I call it CC because it's kind
Hmm.
of fun, right? The
Yep.
main
Cannabis
point,
care
cannabis
or
care subject matter
subject
expert.
matter expert.
So it's
Yeah.
the CC program. That's why it's fun. And then what I did was I wanted them to understand, hey, we fall within the nursing education
Mhm.
part. And that's why we can talk about it because I've got patients that are experiencing symptoms and we need to provide them care. I did call my nursing boards to confirm and clarify where
Mhm.
do I fall within this guideline. And trust me, my board was like, and you are, and you're what? And
Yeah.
you're where? And I said, look it up, Pacific College of Health and Science and cannabis care. And I am a professional. There's such a thing as a cannabis care nurse. And so at that point, they were like, wait, 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 we need to scramble on this. And so they sent me to the director of, like, he was the interrogations or something like that. And I'm like, sir, I just want to let you know before I start anything, I want to clarify from my boards. And sure enough, he says, you're falling under nursing education. I said, yes, sir. That is exactly what I'm doing in nursing care. Every nurse educates their patients.
Yeah. And
So
at this point in time, is the scope and standard published that you can use that as evidence, or is it not published yet?
not yet at that point
Okay.
because
Okay.
it
Yeah.
was so early. Now
Yes.
I have the scope
Yeah.
and practice that I do use that book, by the way, when I present. I
Yeah.
said, just to let you know, there is literature, there is a scope and practice that we follow, a guideline, okay? And it is in the process of getting credentialing. And at that point, whoever I talk to, whoever I'm right in front with, literally relaxes. And now, in my presentation, then the fun really begins. Because then we dive into what cannabis nursing is and what cannabis is.
Right.
You
Yeah. It
know,
brings the legitimacy, right? It's
there
like,
you go. Yes,
especially in a field, right, in the healthcare field where everybody has a million letters behind their names, right? It's like,
yes,
okay, so how can we be on that professional level? And it's like, okay, well, hey, we're going to be credentialed in the future. We're going to have that opportunity. And then you're right. People are like, oh, well, if ANA is behind it and they think it's
exactly,
legit, like, well,
exactly,
clearly we're legit and we can continue
exactly,
the
right?
conversation. Yeah, yeah.
Exactly. I've had doctors come back to me and say, Michelle, talk to me about the science behind it. And so I'm like, okay, how many
Yeah.
articles do you want me to send you? You know, how
Yeah.
long do you want to sit there and read the articles? And so at that point, it creates, you're right, that legitimacy and acknowledgement. That's
Yeah.
the most important because stigma comes like in my opinion, the barrier that I've experienced, the first one is misinformation, right?
Of course.
And lack of education. Those are the two big barriers. The third one is actually stigma.
Mhm.
I'm shocked because I thought the first one would be stigma. No, it's actually miseducation and
Yeah.
misinformation.
Yeah.
Then stigma comes along. And
Mhm.
then there's this lack of confidence. It's like,
Mm.
how do you really know, what do you really know about cannabis care?
Yeah.
And once I start discussing, then they sit there and they're like, oh, yeah, I kind of have something to say. And at
Yeah.
that point, then the trust is built. The
Mhm.
trust is built. And that's why I always tell my patients, like, not just my patients, but people, one of the other barriers is, number one, we're not really like nurses, we're kind of a little bit more, we're strong. They know we're
Mhm.
strong, they know
Yeah.
our stuff. But when we start suggesting something, when we start like bringing something up that's not really in the norm or in the,
Yes.
they're like, I don't know. You are a good nurse, but I don't know about this field, right? But
Yep.
the second we start something, because we're pretty much observers, right? Because the doctor comes in, the doctor is the one who orders and all that stuff. But we know our patients well. At the end of
Yeah.
the day,
Yes.
me about my patient, and I will tell you hour to hour. minute to minute even, and so that creates the legitimacy, right? And those are the barrier. But the one thing that I've had a biggest issue about the barrier in the business model is another thing is, how can you make the business stronger,
Mm. Yes.
right? And
Yes.
I think that is a big part of us in cannabis nursing coming into the field,
Yes. Yes.
because there's so many, the immediate, in my class at Pacific College, the biggest thing was, oh, I'm going to be an educator, I'm going to be a nurse educator, right? Our first thing. But then we sit there and we're like, how am I going to get there?
Yeah.
What are the steps? That's the what that nobody really has an answer for us in school. But here's what I'm always going to tell my fellow cannabis nurses: look at your expertise first.
Yes.
Don't
Yeah.
look at the big picture, because unfortunately we are not, our expertise is what will guide us to where we're going to go, because
Yeah.
that's what we know. That's what we're good at, right? And how can your expertise contribute to cannabis nursing? That's the question we need to ask. We
Mhm.
don't all have to be in the same route as what
Right.
the other people are, okay? Because it it's not a one-stop shop for everybody. It's not. And that's what I learned in this, because I happen to be in the health insurance field.
Right.
So that's my in. That's what I tell them. That's my in. I'm already there. I'm not about to recreate the wheel
Yeah.
in another field, because I'm already there.
Yeah. Start where you are, right?
Not where you
Start where you
are.
are, see where
That's
your
right.
skills are, see where your environment, and it will fit in, right? It fits in everything.
Exactly. How does it already fit in where you're at? Is
Yeah.
That's the key. And then the biggest part is, bring in people who support you.
Mhm.
If they are asking you consistently, undermining what you know and who you are, they are not your people.
Yeah.
The people that should be with you are the ones who are going to say, keep going. I think that's awesome. What's next? So what now? What?
Yeah.
Right? Because
Yes.
the same CMO and VP who opened the door for me also sent a team with me that is very supportive.
Mm.
And that's how I'm able to open more doors into the business, because they're like, hey, I believe in you. And I
Mm.
know that you know what you're talking about. So let's go and get it going.
Yeah.
And sometimes I'm like, it's scary, because I'm like, I'm talking cannabis here, people. But they're like, yeah, but you're the nurse. You know
Yeah.
cannabis nursing. You're like, okay, 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 okay. Take a deep breath and keep going. Keep
Yeah.
going.
The imposter syndrome is kicking in,
Yeah.
right? But
Yeah.
it's like you're doing it. You're there. And
Yeah.
kudos to you. I mean, it's powerful to make that transition and fight through your imposter's syndrome and be there and be confident, right? It takes time.
Right.
And to
Right.
have a team behind you, man,
Yes.
that is life changing.
I mean, it's the one thing that really is, now I'm at the process, because we started in June of last year, is
Mhm.
now we're seeing patient results, right? So now I actually have been able to document patient events we're in, because what we did was we immediately created a wraparound
Mhm.
services that
Yeah.
is specific to the cannabis patient, right? And then we educated everybody. We educated our hospitalists, we educated our inpatient nursing team, we educated our post acute team, our primary care, we brought in our specialists. It is such a big, I'm like, I didn't even know how big it was until doctors started calling me and say, hey, I kind of heard something about what this is. And then I'm like, okay, okay, okay. And then the logistics about, okay, we need to create a brochure. I'm like,
Yeah.
oh, we do? What?
Yeah.
Huh? We need to put that in the
The education
website.
portal,
Yeah.
right?
And I'm like, what? Excuse me? Huh? I need to create that? And so it was that. But then when the patient started kind of
Mhm.
giving their feedback, and then I started reporting on the patient, and now we're like, what? We literally are building our database now.
Right.
We're actually creating, and I actually am working with a data analyst now, and we're now getting the numbers. What is the return of investment? That is a big thing. I
Yeah.
learned. And I'm like, what is that? And they're like, that's kind of like showing your worth now. I'm like, oh my God. Okay. So every day I am like this, hands up. And I'm like, hey, you know, energy, creation, God,
Mhm.
whatever that is, please keep me, keep me in the positive.
Yeah.
Keep me knowing that, hey, what we're doing and what we're introducing is a good thing. And it's
Mm.
helping people and it's taking care of people. That's all at the end of the day. At the end of the day, right? If it's not worth the time. It's not worth
Right.
the effort. But my patients are saying, Michelle, you're actually giving me something different. I actually have something to grasp on. And when a patient tells me, thank you actually gave me a way out. I had one patient that I will never forget what she said. She said that we have been in the shadows for so long.
Mm.
We have been so afraid to access care because we are looked upon as people who don't deserve care. And I said, what? You deserve care as much as anybody does. And who
Mhm.
are we to say that? It's because of a stigma from a guy like back in the when,
Yeah.
right?
Yeah.
And I
You're
said, shadows? As a nurse? That no, you come. I said, you bring me all your questions. You bring me your concerns. I'll bring it out. I'll bring it out to the world, right? And to be honest with you, Nicole, I never really did not look at the proactivism or being, of being a cannabis nurse.
Yeah.
It comes with a responsibility. I
Yeah.
just wanted to take care of my patient, right?
Yeah.
But now I'm like, oh no, we are providing light. We are giving as much
Yeah.
light as we can on this one because these are patients as well, and they're growing. In my area, they are growing, and then still, there's so many that don't know. Now I'm getting the pediatric patients. Now I'm
Mm.
getting the pregnant patients. It's crazy because then they're like, where's our cannabis expert? And I'm looking at it and I'm like, can you just call me cannabis nurse, please? I mean,
Yeah.
I'm like, I am a nurse first, right? The expert will come later on because what we do is taking care of a patient's first.
Yeah.
That's it. And it's just so nice to hear that, hey, now we're acknowledged. Now we're in the same table. We have a spot. And I said, how much more and I hate to say this word right now, okay? Because it's a very sensitive word, but we are asking for a part of the world that needs to be a lot more diverse.
Yeah.
We are asking to be a little bit more into, hey, can you include me
Yeah.
in this diversity
Yeah.
of not just the cannabis, but in patient care
Right.
and acknowledging medicine. Number one, we need treatment. We need treatment, right?
Yeah.
Consistently. And if it's working, it's good treatment. It's
Right.
positive treatment. At the end of the day, who are we looking at? Our patients.
We wouldn't stop any other treatment, right? If it's working and the patient is responding
Exactly.
well, we wouldn't say, "Oh, actually, you gotta stop." But
Yeah, sorry. Yeah, it's actually helping you not feel bad. But you know what? We can't keep going.
yeah.
Are you serious? Are you serious? What
Yeah.
quality of life are we providing that patient?
Right.
Exactly, right? And so now we're asking, hey, let's be equitable.
Yeah.
Let's be equitable. Because that's what we're providing our patients is
Mhm.
equitable treatment,
Yeah.
equitable care.
Yeah. Right.
Right. And it's like, we're talking cannabis. Talking cannabis nursing. Yeah, not a lot of people are still going, huh? What?
Yeah. It's a mystery out there, right? But what you're doing, and as I'm listening to you, I'm thinking you're embodying every aspect of our mission statement. You're advocating, you're collaborating with CMOs, with physicians, with patients, the trifecta, the everybody.
Yeah,
You're researching,
exactly. And
you're
this is a
educating.
nurse. Exactly. And
Yeah.
this is a nurse who is telling you, who is talking to you, who is creating, for lack of a better term, dialogue.
Yes.
It's dialogue. And that's the most important part because at the end of the day, we're affecting our patients.
Right.
We're also creating inclusivity for our patients. They're no longer in the shadows,
Yeah.
right? And they're coming out. And I'm like, thank you. And when parents come up to me and say, hey, you really made a difference when you talk to my
Mhm.
kid. And I'm like, thanks. I appreciate that. I've never
Yeah.
been a pediatric nurse. I don't want to go into pediatrics because
Yeah.
I'm a mother and it's hard, it's emotional. But
Yeah.
now I actually found a medium that I can actually help my pediatric patients to understand, you know. And
Mhm.
it's crazy that the amount of interdisciplinary team like
Mhm.
work, and
Yeah.
it's like, Michelle, it's like, yeah, you know,
Data, policy, and
yeah.
procedures,
I'm like, hey, I need my
regulatory.
BH team, right?
Yeah.
I need my RD. I need my therapist here. And
Yeah.
it's just like it's amazing. And we still continue to grow. We're still continuing.
Of course.
Sometimes it's a lull, sometimes it's quiet because of course we're so new. We're the new kids in the block. So they forget about us sometimes. So I'm like, whenever we have a meeting, I'm like, can you please don't forget about the cannabis patients? I
Yeah.
always say that. And they're like, I can see some people rolling their eyes because they're like, she's always in our meeting. And I'm like, hey, you know what? It's just a matter of it. I always thought it takes what, 19 times for me to say something for you to remember me? So, hey, I'm coming for my 19th time. So
Yes. I'm here.
I'm
I
here.
might be in
I'm
the
just
corner. I might not be at the front of the table, but I'm here. And
here. I'm here.
I
Yeah.
think that that's so powerful. And your story is powerful. And I think sharing it with our fellow nurses, cannabis or not cannabis nurses,
Right.
right? It gives us pride as cannabis nurses. It gives us legitimacy. It shows us a pathway, a journey,
Yeah.
someone with the expertise. And okay, expertise, another garbage word that we use
Whatever,
in
yeah,
society, right?
whatever that
Expert.
is, right?
But
Exactly.
you are bringing that legitimacy, and that's what we need in this space, in this industry. And you're plugged in, and you're going to continue to inspire our fellow nurses. So I want to say thank you for sharing your story. It's powerful.
Thank you
And
so much. I so truly appreciate it.
yes,
Thank
yes,
you. Thank you.
thank you. I appreciate it, Michelle.